To our provider education session today on the diabetes prevention program. My name is Jessica Reeker. I'm the community health educator here at Good Shepherd.
And my name is Chris Madrigal, and I'm the health and wellness coordinator here at Good Shepherd.
So today we are going to run through the diabetes prevention program. This is a CDC recognized program. It's a year-long prevention program for individuals with pre-diabetes. So we're really doing this session today to partner with our providers, Good Shepherd, Marisol, everyone in the community really, to try and find these people that we want to reach that are at risk for pre-diabetes. So we are going to go through some program guidelines and a few of the materials that we will be getting to your organizations and departments for you to start utilizing this program and referring them back to us for this program. So we will go ahead and get started. We're going to start screen sharing, so don't worry if you don't see anything yet. Okay, so is everyone able to see this okay?
Yeah.
Perfect, okay, great. So this program is called the Prevent T2 program. So again, this is a proven program to help prevent or delay type 2 diabetes. So what we're going to go through is the program focus, the goals of the program, participant eligibility, things like that, to see who this would be beneficial for. As you all know, we do have a higher than other areas rates of obesity and overweight individuals in our area. So that's one of the main criteria for this program. So this is really going to be a really large group of people in our community. So the focus of this program, again, it's a year-long program designed for people with pre-diabetes and also those who are at high risk for type 2 diabetes and want to lower their. So even if you haven't been diagnosed with pre-diabetes, if you have a history of gestational diabetes or you meet some of the other risk factors that we'll go through here shortly, this program would be perfect for them as well. The main goals of this program are to achieve a moderate weight loss by eating well and being active. So by the end of the first 6 months of the program, which is what we call the core of the program, the goal of the participants is to lose 5 to 7% of their starting weight and get at least 150 minutes of physical activity each week at a moderate pace or more. So what we go through in these sessions, the way this program is laid out, and we will run through that in more detail as well, but we meet weekly at the beginning of the program, and then that goes to bi-weekly and then monthly once we get into our maintenance phase. So we do weekly weigh-ins for participants, as well as encourage them to participate in food logs and fitness logs as well. And so that's how we track these things, and then using motivational interviewing and a few other tools that we have learned becoming certified lifestyle coaches for this program, we are able to help them in whatever barriers they're experiencing to meeting these two goals.
Yeah. So by the end of the second 6 months, the goal is for participants to keep off the weight that they had lost during the core sessions, keep working toward their goal weight if they haven't reached it, lose more weight if they wish to continue implementing the program and the tips that they've learned, and keep getting at least 150 minutes of activity each week. As Jessica pointed out, it's a year-long program. So the first 6 months we'll be doing the core. The second 6 months, basically, it's retention. It's keeping up with the goals and the progress that they made previously during the core program. And then the program structure. So in order to achieve CDC recognition, your program must last a full year and complete at least 22 modules. So we suggest meeting once a week for 4 months, like we talked about previously, sessions 1 to 16, every other week for 2 months, sessions 17 through 20, and then once a month for 6 months, sessions 21 to 26. So we can follow a different schedule, but we must complete at least 16 sessions in the first 6 months and another 6 sessions in the second 6 months to be CDC recognized for the program structure.
And we applied for CDC recognition earlier this year, and we were approved as of May of this year. So that's why we will be starting. The first DPP program does start October 1st. So that's why we are doing these sessions right now. However, this will be an ongoing program that we will be implementing in the education department. So we will have ongoing sessions that people can join at least twice a year. At this point, we do have 3 certified lifestyle coaches in our department to be able to utilize this program. So we are approved, and we will be starting these soon.
So our role as a lifestyle coach is to help participants set goals. We're going to track their eating and activity, assess their progress, and solve problems along the way. We're going to collect data and write it in their lifestyle coach log. The biggest thing is setting our participants up for success. They're going to have to set up new goals, set up new lifestyles. There's going to be challenges along the way. Our biggest thing is to help them be as successful as possible being their coach. And we also want to set the tone. So we want to foster a supportive and respectful group culture and encourage participants to share their thoughts and feelings. This can be a big change for someone, trying to change their lifestyle, to eat healthier, to exercise on a regular basis. But we don't want to pressure them into this. We want to make sure that all participants get a chance to speak and that their thoughts and feelings are being heard.
We as lifestyle coaches really are facilitating these weekly, biweekly, and monthly sessions. We are not teaching, we are teaching, I don't want to say that, but it's not just a talk at the participants. We really encourage, like Chris said, that group.
We're trying to be an advocate for these.
Exactly, yeah. We just want to facilitate them to help them work through their goals and whatever issues, things they need to overcome themselves. So that's really the basis of this program. So we kind of spoke on these as well. Most sessions are just going to be 1 hour. So keeping an eye on time, this talks about, because we do have to do weigh-ins and things like that every week, and supporting participants. So again, we've talked about this. With COVID going on, we are planning on having these sessions in person. We have booked the large conference rooms here at the hospital for these classes, and we just have a maximum number of participants that could meet in person. We will be also offering this virtually as well. So anyone who wants to do this program does not have to come in person. They can join virtually, and then we will work through remote weigh-ins and turning in food logs and things like that. So the participants' role, this is kind of a review as well, but they're required to track their minutes of activity and their just in their fitness log. We'll be providing fitness logs and all the materials for this program. This is completely free for individuals to join, so we will provide everything that they need. They will have their participant notebook that they will bring every week, their fitness logs, again, their weigh-ins. At home, they are encouraged to track their food and some details about their activities. Some of the sessions that we offer are on how to change up your fitness routine and things like that to prevent boredom and just
redundancy.
Exactly, yeah. So those are kind of the participants. And then what we'd like to do is just kind of show you a brief overview of kind of what this program goes through, because it's not just, lose weight. We always tell people, well, just lose weight. That's all you need to do. But there's a lot of other factors with losing weight and having a healthy lifestyle. So this program really touches base on those. So again, the first 6 months of the program are going to be the core modules. So the first week is the introduction. So we just talk about the program. The second week is getting active. So again, talking about principles of getting active, ways to stay safe, ways to increase your activity, especially depending on where your beginning start point is. That's going to be different for everyone. Tracking your activity. Then we go into eating well. This talks about food labels and the differences between, proteins and fats, and some of those basic things that not everyone knows, or you might have known 10 years ago, but things are always changing. Tracking your food. Ways of getting more active. So again, like Chris said, preventing redundancies. burning more calories than you take in, shopping and cooking. So this is a great one. I really liked when we went through this one in training, talking about the relationships between grocery stores and shopping and how that affects everything. Managing stress. This will be a big one come the holidays. Finding time for fitness, coping with triggers, keeping your heart healthy, taking charge of your thoughts, getting support. So this is going to be either medical support, social support, family, all of those different aspects. Eating well when you're away from home. So another big one again, when you're going out. It's inevitable that you have to eat out with different events and things. Well, maybe not with COVID, but eventually. And then staying motivated to prevent, again, type 2 diabetes. And this is what's recommended before we start the maintenance modules. This is how because at this point, we'll only start seeing our participants monthly, in person at least. This program is set up so that you can do phone calls or keep in touch using apps or different things, whatever you choose to use. So we have a few of those little things to work out still. It's really going to be based on what the participants are comfortable with. And then for the last 6 months.
So we'll talk about when weight loss stalls, how to do that, how to work with participants to start losing weight again and assess their weight loss when it slows down or stops. Taking a fitness break, how to overcome barriers, and taking a 2-minute fitness break every 30 minutes to show them that you can take a break and still make progress. Staying active to prevent T2, so how to cope with some challenges in staying active. It's always hard, like I said earlier, to incorporate those changes. How do we continue to keep that momentum going? Staying active away from home, to track your fitness goals when they travel for work or for pleasure. How do you stay active while you're still enjoying yourself? And then more about T2, so a deeper understanding of type 2 diabetes, how to manage it, what it entails. I want to give them all that information. More about carbs, a deeper understanding of carbohydrates, how they affect the body, how do you utilize them for energy, things of that nature, and have healthy foods you enjoy. So have foods that you enjoy that are healthy, how to make these a part of your everyday routine. Getting enough sleep, it's very important to get enough sleep, and how to cope with the challenges of how to do this, how to set up a sleep routine, and then get back on track. What to do when you get off track. Inevitably, you might, like I said earlier, you might slow that momentum a little bit. How do you get back on track with your eating and your fitness goals? And then prevent T2 for life. So this will be the end presented at the last session. This would help participants reflect on the progress they've made and how to keep the positive change going over a long-term period. Hopefully, like it says, for the rest of their life.
And so as we've said, this all takes place over a year. So at every session, we'll be reassessing their weight loss goals and their fitness goals that they have set, and if they've achieved them and what their long-term goals would be. At this last session, or working up towards this last session, if participants are interested, we will also start either monthly or quarterly, something like that, like a check-in session. A lot of DPP facilities do offer that. So if participants are interested, our lifestyle coaches here in the education department will offer those just to keep people, say, on track more long-term. So that's kind of the basis of the program. So again, 1-year program, they do have to meet program eligibility. We'll go through that. So the purpose of this session today, which we're now going to talk more about, is that we are really hoping that our healthcare providers here at the hospital and throughout the community will start referring individuals who this would be beneficial to us. We can have a certain amount of reach here in the education department with our Connections program, and we do have some clients that this is appropriate for, but you all are really the ones who are out there more often and seeing people's A1C, and if there's certain trends in a particular patient, things like that you think, well, maybe this would work for them. This is the lifestyle change program. This is going to be beneficial for these individuals. So this is a handout that we will be giving to you. This is a DPP fact sheet, and this is going to give you basics of everything that we just went through. But this will tell you which of your patients are eligible. So you can see right here, To participate, patients must be at least 18 years old. They must be overweight, which is a BMI greater than or equal to 24 or 22 if they are of Asian descent. Have no previous diagnosis of type 1 or type 2 diabetes. Have established risk factors or developing type 2 diabetes, or been diagnosed with prediabetes within the last year, or gestational diabetes in the past. So some of these things are self-reported, but there are ways that that you all could help us with this as well, because these are CDC requirements. So we can't just, if someone says, well, I'm interested in that, I'm overweight, but I don't meet any of these other things, we're not able to enroll them. That's not something that we control. The CDC wants to see this data on this. So we will have to have some information. Again, some are self-reported. However, if someone has been diagnosed with prediabetes, that almost immediately qualifies them for this program, but we need a provider to tell us that. So here's some information on the program. Again, everything that we just went through, so we won't run through that. Eligibility. And then on the back side here, it tells you how it works. Again, trained lifestyle coaches, we have 3 of those. How your patients can access a program near us. So there are other ones. There's a virtual one, Eastern Oregon, the Oregon Wellness Program is offering one as well. But we are, again, going to have one here in person and virtual, and again, this will be ongoing. So our first session starts October 1st. However, we'll have another one starting after the first of the year. So this isn't something you can only refer your patients for the next month and then it's over. What we're asking is that you continuously refer people to us for these programs, and we will start programs as needed depending on what the demand is like in our community. And again, here's information on recommending patients. So education department, our phone number and our email. So very simple when we can register individuals there. Another resource that we will be giving you is the DPP brochure. So this is for any patients. We actually recommend that you would keep this in your waiting room or something too, just if there are people interested, or if someone has a visitor with them or something that you might not be seeing. And if they're interested in the program, this has information, again, very similar information. Our information here, education, prediabetes can lead to type 2 diabetes, a little more information on that, who is at risk for type 2 diabetes, how to make a change, information on the program. But the difference on this form is that on this back side here is a recommendation form. So you as the provider could fill this out saying, I recommend my patient, John Doe, join this DPP program based on the following factors. So if they have an A1C of 5.7 to 6.4, you could check that box there, and then we already know that they are eligible, and then we don't have to contact you for any future eligibility, paperwork or anything. And then you would give this to the patient, and they would bring it to us, and we would get them signed up, and they would be in the program. So these will be, the brochure and the fact sheet will both be getting delivered to your departments and or organizations, for those of you listening to the recorded version of this. And this gives you all the information that you really need, but we're here to answer any questions. Again, our first session starts October 1st. Do you have anything you'd like to add?
I don't think so. I'd really highly recommend, if you have anyone that you think could be participate in the program, like Jessica mentioned, we'd really love to have them, their information sent over to us. We'd love to have you, like she was stating earlier, you have access to these people on a regular basis. We'd love to have them in the program. I think it's a wonderful program where people can make a lot of progress. So anyone you can send our way, we'd really appreciate it.
And again, it's completely free. We do not charge for anything. If someone needs help purchasing a scale or something like that, we will work with them. So there are no prerequisites or anything besides the criteria, of course, but they don't need to have anything set up for this. We can help them with anything they need. The only other thing I'd like to mention is just to remind everyone that here in our education department, we do have our Connections program that helps patients with medical or social needs. If you have patients that have needs, we are still working here Monday through Friday and doing home visits and medication management, things like that. We also have certified tobacco cessation counselors that are still seeing patients in the office and helping. We had a patient come in today just this morning say that she quit smoking because of one of our counselors. So one of our recent success stories. It's very exciting. So just wanted to remind you guys that we are here still offering those services as well. So I'd like to open it up for questions if anyone has any questions. We will stop sharing here so you can see us again. Kind of a lot of information, but again, if you have any questions, just call the education department. We're at 541-667-3509. But we will be getting some materials to you as well, so if you have any other questions, you could see this. No questions? Thank you. Okay, well, thank you for joining us today. Again, call us if you have any questions. And we're here and we're excited to start this program. Thanks, everyone.